My name is Richard, this is Nick. We're going to be doing a physical today. For the purposes of time, I've asked the patient to empty their bladder prior to the exam. I've also asked them to put on a gown. And I've also taken the liberty of getting a set of vitals. Patient's vitals are heart rate is 96, blood pressure is 120/71, temperature is 97.9, and pulse ox is 100% on room air. Patient is 5'7", 150 pounds. So first we're going to start off looking at the head and face. We're going to check the, we're going to be looking at the skin first, checking the color, looking for any excessive moistures, lesions, any nevi that we could probably dictate, and then take a look at for future reference to see if there's any changes in those. Also looking at the symmetry, checking the eyes and the ears, looking for equality on both sides. Looking at the skull for normal size, shape, symmetry. And next I'm going to have you do a few tests, examining some of the cranial nerves. So can I go ahead and have you clench your teeth? Good. Patient's able to do that. And squeeze your eyes tight. Alright, and that's good too. That's examining cranial nerve 5, the trigeminal. Next time you wrinkle your forehead. Up with your eyebrows. Perfect. And go ahead and smile for me. Good. And that's cranial nerve 7, the facial. Go ahead and stick out your tongue. Side to side. Up, down. Good. And that is the cranial nerve 12, the hypoglossal. And that's all fine. And then go ahead and puff out your cheeks. Good. And that's also cranial nerve 7, the facial. And all of those seem to be fine. Next I'm just going to go ahead and feel around in your head here. Feeling the scalp and the hair. Checking for any abnormalities. Looking for hair distribution as well. Next we're going to be feeling some of the facial bones. Good. Any tenderness at all with that?
Nope.
Alright. And checking the TMJ, go ahead and open your mouth. And close. Any pain?
Nope.
Good. And we're checking for any sort of clicking, any sort of hang-ups or pain with that. And then next I'm going to check your sinuses. Any pain at all with that?
Nope.
It's the frontal sinus, and then the maxillary. Any pain at all with that?
Nope.
Good. And that's all normal as well. Next we're going to be doing light sensation, so I'm just going to have you close your eyes and just tell me if you feel it at all.
Yep. 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 Yep.
Good. And that's also cranial nerve 5, the trigeminal, and that is also normal. Alright, we're going to move on to the eyes next. First I'm going to be looking at your eyelids and eyelashes. Close your eyes for me. Good. And we're just looking at the hair distribution, any puffiness, checking for any tremors at all within the eyes. And go ahead and look, just pick a spot on the wall straight ahead. I'm just going to be looking at the sclera, checking for any foreign bodies, erythema, or any exudate. And that all appears to be normal as well. And I'm just going to, while I'm here, I'm just going to palpate your lacrimal apparatus right under the eyebrow. Any pain at all there?
Yep.
Good. Alright, next we're going to be doing a couple tests, light reflex tests. I'm going to go ahead and have you look forward for me. Just go ahead and pick a spot on the wall up there. And just checking the direct and indirect pupil response, and they both constrict on both sides, direct and indirect. And next we're going to be checking the red reflex. Again, I'm just going to go ahead and have you just look straight ahead at the wall. And good. So I'm just going to hold the side of your head here. And we're just looking for any sort of checking the optic disc, looking for any spots. Any asymmetry on both sides could indicate a problem. We're also looking for any hemorrhages within the vessels. And everything's good in there. Next, I'm gonna go ahead and have you go ahead and follow the end of my pen right here, checking the visual fields. Good. And all those are normal. That's cranial nerve 3, 4, and 6. Next, we'll go ahead and move on to the eyes, or I'm sorry, the ears. Checking the alignment first, looking at the shape, size, symmetry, color, and all that appears to be normal. I'm going to go ahead and feel the ears now, feeling for any sort of nodules, any tenderness at all, palpating around the auricle. Good. Next, I'm going to go ahead and assess this hearing. We're going to do something called a whisper test. So I'm going to have you cup one of your ears. I'm going to lean forward and whisper a 2-syllable word. Let me know what that word is.
Tiger.
Good. And correct response. Go ahead and do the other ear. And that's also correct. So a whisper test is normal. Next, we're going to go ahead and use a tuning fork. And we're going to go ahead and listen for bone versus air conduction. So what I'm going to do first is go ahead and I'm going to go ping the tuning fork. I'm going to put it behind your ear. I want you to tell me when you stop hearing it. Then I'm going to put it on the side of your ear, and then I'm also going to tell you when you stop hearing it.
Okay.
Okay? And we'll start with the left ear. And I have a clock on the back wall behind me. I'm watching.
Stop. Stop.
Good. Now I'm going to check the other ear.
Stop. Stop.
Good. And air conduction is 2 times the bone conduction on the right ear. The left ear, it's a little less, but it appears to be within normal limits. Next, I'm going to go ahead and take a look inside your ear. Now, what the last test was cranial nerve 8, that was the vestibulocochlear. We're checking with bone conduction, air conduction. All right, so we'll start with your right ear first. I'm going to go ahead and pull back in your ear. Good. All right. And tympanic membrane appears to be gray, pearly, no redness or any perforation. Go ahead and look at the right, or I'm sorry, the left. Okay, and the same with the left ear as well. Next, we're going to go ahead and take a look at the nose. First, we're going to evaluate for shape, size, color, and all that appears to be normal. Also going to be looking at the position of the septum, looking for any alignment, any deviation. Go ahead and tilt your head back for me. That was all good. I'm going to check for the patency, so what I'm going to have you do is cup one of your nostrils and just breathe out for me. Any problems there? And let's check the other side. Good. All right, and no problems with that. Next, we'll go ahead and take a look. Go ahead and tilt your head back there. Good. Just looking at the mucosa, the septum. Oops. There we go. Mucosa and the septum up here. Looking at the turbinates as well. Checking for any discharge, any discoloration, any masses, and I don't see any, and that all appears to be normal as well. Next, we're going to go ahead and take a look at your mouth. First, we'll just do the inspection, looking at the lips, the buccal. Go ahead and open up for me. Buccal mucosa. Just going to turn around here. Good. Checking the gums, the hard palate, and the soft palate. Good. We're just checking for any symmetry, color, lesions, any edema, bleeding perhaps. Also looking at the anterior and posterior pillars and the uvula as well. Stick out your tongue. Good. Looking at the tonsils, checking for any excessive odor of the mouth, which I don't sense. Any odor or white patches or exudate could, inflammation could indicate some sort of infection. I've also inspected the teeth, the number, the surface characteristics, looking for proper alignment, any excessive wear or missing teeth as well. And go ahead and stick out your tongue one more time. Lift up for me. Tongue up. There you go. And checking the sides. My flashlight went out. Good. And the other side. Good. Looking for any lesions, masses, or any limitations of the color, characteristics and symmetry of the tongue. Also, I'll go ahead and check the gag reflex and go ahead and stick your tongue out. Good. Good. The gag reflex is normal. You get equal elevation of the uvula on both sides. And that's cranial nerve 9 and 10, which is the glossopharyngeal and the vagus nerve. All right, next we're just going to be looking at the neck. Going to be checking the symmetry. First we'll inspect, we're looking at the symmetry, smoothness, making sure it's not good. Looking at the thyroid, any jugular venous distension at all. Actually, let's go ahead and do some movements of your neck. Bring your chin all the way to your chest. Go ahead and look up at the ceiling. Good. Right ear to your right shoulder. Left ear to left shoulder. Turn to the left. Turn to the right. Okay. And shrug your shoulders up. Good. And the shoulder shrug would be cranial nerve 11, which is the accessory. Next, I'm going to go ahead and do some of the same movements. I'm just going to apply some pressure. Press against my hand. Good. And this way. This way, this way. Any pain at all with any of that?
Nope.
All right, and all that appears to be normal with range of motion. Next, we'll go ahead and palpate. I'm going to check your carotid arteries first. One at a time, of course. And we'll check the right side. Good, those are fine. Go ahead and check the tracheal position. And for me, check the thyroid here. Looking for any swelling, making sure everything's in the midline. Next, we'll go ahead and feel some of your lymph nodes here. What we're going to be looking for is any sort of red streaking, any sort of tenderness, swelling perhaps. First, we'll check the pre and post auricular. Any pain or tenderness with that?
No.
Good. We'll check the occipital. How's that?
Good.
And the tonsil. No problems there.
Nope.
Submental. Submandibular. Good. We'll check the superficial chain. Any pain at all with any of that?
Mm-hmm.
And posterior cervical. Any problems there?
Nope.
Alright, next we'll check the deep cervical. Any pain there? And the supraclavicular. Go ahead and your shoulders go up. Any pain in there?
Nope.
Good. Next, I'm going to go ahead and listen to some of the carotid arteries with the valve of my stethoscope here. I'm going to go ahead and have you hold your breath while I'm doing this. I'll let you know, okay? All right, go ahead and hold your breath for me. Good. Go ahead and breathe. And one more time. Good. Relax. Listen at the thyroid here. Good. And no evidence of any thrills or bruises at all. Next, we'll go ahead and examine some of the extremities. So, I'm just going to move your count up here. First, we're just going to look at the hands, checking for any nevi or nevi, any deformities at all, looking at the arms, the shoulders, any scars, lesions at all, and that all appears to be normal. Let's also do some range of motion here. Bring your arms up. Don't let me press them down. Good. And bring them all the way down. Hands up. Don't let me press them down. And press against me. Good. And wrist out. Bring it up. Good. And bring it down. Good. And grab my hands. Alright. Appears that all the muscle strength appears to be normal in the hands, arms, and shoulders. Skin also appears to be a bright color. I don't see any edema at all. Go ahead and check the nail beds here. Good. And now appear to be normal. No signs of pitting or any fungus or any irregular shapes. Next, we'll go ahead and evaluate some of the pulses here. I'm going to remove your bracelet. First, we'll check the radial. Relax on your hand there. Good, strong radial pulse, 2+. We'll check the brachial. Relax your arm in my hand. And same with the brachial pulse. Check this side. Relax on my hand. And that's 2+ as well. Good. All right. And we'll go ahead and move on to the back here. All right. First, we're just going to inspect the skin, looking at the thoracic configuration at all, and that appears to be normal. No sign of any sort of scoliosis or any lesions, any questionable nevi at all. We could make a note of that as well if we do see that. I'm going to go ahead and next I'm going to go be tapping on your back here. Open up your gown a little bit. Perfect. First, we'll go ahead and palpate the costovertebral angle. And then I'm going to go ahead and percuss that. Go ahead and lean forward just a little bit. Perfect. Good. And that all appears to be in normal position. Next, we'll go ahead and evaluate the lungs. First, throughout the exam, I've inspected the respirations. The patient doesn't appear to have any labored breathing, any accessory use, or any use of the accessory muscles. Next, we'll go ahead and palpate the expansion of the lungs. So I'm going to put my hands on your side here. And right around T10, we'll go ahead and put my thumbs together. Go ahead and take a deep breath for me. And all the way out. Good. and my thumbs clearly separate, which means we're getting good expansion of the lungs. Next, we'll go ahead and check for tactile fremitus. So what I'm going to do is put my palms on you. I'm going to have you say 99 each time, okay?
99,
Okay, ready, go ahead.
99, 99, 99, 99.
Good, that's all normal. So we're looking for any sort of excessive or lack of vibration. We want basically uniform vibration throughout the lung fields, which I do feel. Next, I'm going to go ahead and percuss the posterior chest, so if I can have you lean forward a little bit. Good. Now check the lateral side. Good. And no dull spots at all. And normal percussion within the lung fields. Next, we'll go ahead and check for diaphragmatic excursion. So what I'm going to do with this is we'll go ahead and, with your lungs empty, I'm going to go ahead and tap on you, and we're going to feel, I'm going to go ahead and mark with a pen where your diaphragm's at. Then I'm going to go ahead and have you empty out, or inhale, and then we'll check that as well, okay?
Okay.
Go ahead and empty out your lungs there. Ready? Okay. And we'll mark that. And take a deep breath in. Good. And we'll mark that as well. And go ahead and breathe normal. Good. And it appears to be within like 3 to 5 centimeters, which is normal. So that's all fine. Next, I'm going to go ahead and listen to your lungs. We'll listen from side to side, and go ahead and take some deep breaths for me, okay?
Okay.
And we'll listen with the diaphragm. Good. And let's go and listen to the front here. So is it okay if we bring your gown down here?
Mm-hmm.
You can take your arms out there. Good. And we'll go ahead and listen to your breathing in the front here. Good. And normal bronchiovesicular and vesicular sounds throughout the different areas. Majority vesicular down in here, and then we're going to hear more of the bronchial and then the bronchiovesiculars right through here. And that's all normal, clear sounds, no signs of crepitus or crackling or anything like that. All right, next we're going to just go ahead and evaluate the anterior chest with the heart and the lungs as well. So first we're just going to inspect, go ahead and relax for me. Inspect the skin, the symmetry, looking for any sort of abnormalities, any sort of deformities, possible nevi that we could take note on for future reference for any changes. Again, we've already examined the respirations throughout the exam, and the patient has normal unlabored respirations, no sign of excessive effort or any pulsations or heaving at all. I'm going to go ahead and have you lie down next. Let me clear out some of this stuff. Okay, go ahead and lie back with your head down here for me. Alright, perfect. Hands at your side there. first we're gonna just go ahead and palpate chest wall here. And just feeling the apex, the base, the heart here, down the left sternal border. No signs of thrills, heaves, or any pulsations at all. Next, we're just going to go ahead and feel for the apical pulse. And I already feel a good one, but if I didn't, I can have the patient roll to the left. So go ahead and roll to your left here a little bit. And that's good. Come back over. Next, we're going to go ahead and do that 99 again for the tactile fremitus.
99. 99. 99.
Good, and that's all normal, no hyper or hypo vibrations. And we'll also feel the inner clavicular and axillary nodes. So I'm going to lift up your arm here. Any tenderness at all with any of that? Right along here. Any tenderness at all?
No.
Good, and no evidence of any red streaks at all either. No swelling at all. And we'll look at the left side here. How's that?
Good.
And this?
Good.
No pain? No. All right. Good. All right. Next, we're going to go ahead and just bring your arms right here. We'll go ahead and percuss both sides just to make sure we got good percussion each side. That's all normal. Nice sounds, no unusual dullness where there shouldn't be. Next we're going to go ahead and, we've already listened to the patient's breath sounds, so I'm going to go ahead and move through that area, and we'll go ahead and listen to the heart sounds, starting with the diaphragm of my stethoscope first. And just go ahead and breathe normal for me. First we're going to listen to the aortic area. Typically in this area you're going to hear a good S2. And same with the pulmonic area. And we'll move to Erb's point. Now move over to the tricuspid where we're going to hear a good S1. And over to the mitral. Good. And no evidence any gallops or murmurs at all, normal S1, S2 sounds. I did not hear any S3 or S4, which is also normal. And next we'll go ahead and listen to the bell in all the same areas. And same thing there, that's all normal. No gallops, murmurs, thrills, breweries, nothing like that. Everything appears to be normal. Next we're going to move on to the abdomen. So first I'm just going to bring the gown down just a little bit. We're going to, first we'll inspect, just looking for symmetry on both sides, checking for any, making sure the umbilicus is midline, looking for any lesions, any obvious hernias, and then next we'll go ahead and also want to look for any pulsations or any movements as well. But next we'll go ahead and move on to auscultation. Patient has normal bowel sounds, no hyper or hypoactivity. If I didn't hear anything after a couple minutes, then we might start to wonder if there's any hypoactivity, but everything's normal within this area. I'm going to go ahead and use the bellow of my stethoscope to listen to the arteries. First, we're going to start off with the aorta. Then we'll move over to the renal arteries. Then we'll go and listen to the iliac arteries. And then we'll also listen at the femoral arteries. And that's all fine in there. You all right?
Yeah, stretch.
I'm going to go ahead and percuss next. We're just listening for tone. Start in the right lower quadrant. Listen for any excessive dullness. Could indicate some sort of mass or organ over the area. Those are all normal. Next we'll go ahead and palpate for the liver borders. So I'm going to come down on the right clavicle and right there, and then we'll come up. And it's about 6 to 12 centimeters, which is also within normal limits. Next, we're going to go ahead and have the patient, I'm going to have you cross your arms and just kind of roll to the right towards me. And I'm just going to go ahead and feel for the spleen here, palpate, percuss for that. So we move this hand up. Good. And go ahead and come back there. And that all seems to be normal as well. Next, you can have your arms. Yeah, you can have your arms to your side. Go ahead and do some light palpation here. Let me know if you have any pain at all with this. That's good. And that's all normal. Good. Go a little deeper this time. Any pain at all there?
No.
Alright, good. Next we'll go ahead and check the liver border here. So I'm going to take a breath in for me. Good. And I can feel the lower part of the liver there. And next we'll go ahead and feel for the spleen here. See if you feel the and good. And we'll feel for the kidneys here. And that's all fine. Go ahead and feel for the aortic pulsations. A little pinch in between my hand here. And that's all good as well. And I'm just going to use the end of my hammer here. We're going to stroke the stomach here, and we're just going to check for abdominal muscle response. Good. And that's all normal. Good. And good muscle tone in those areas as well. Alright, next we're going to go ahead and examine the feet. So I'm going to have you pull this up for me. Good. Looking for any sort of, well, first we're going to check the Look for hair distribution, make sure that's all normal, any sort of lesions, any obvious deformities at all we're looking for. Maybe some varicose veins or some nevi we could take note of for future reference if there's any question of changes in those at all. We've already looked at the hair distribution. So, and then we're also looking at muscle mass as well, and checking for any atrophy, making sure there's symmetrical size with the quadriceps and then the calves. Also looking at the feet as well. Good. And also checking for any sort of temperature changes. So you can feel the back of the hand, checking for any sort of temperature. If it's hot, it could indicate some sort of infection. Cold could indicate some sort of circulation problem. Also looking for any sort of edema. If it's bilateral, if it's unilateral, if it is pitting, we can grade the pitting and mark that in our notes as well. Next, I'm going to go ahead and be checking the pulses. Start off with the dorsal pedis pulse. Good, and that is a 2+ on that side. And that's fine there. We'll check the posterior tibial. Good, and that's a 2+. And 2+ on the left side as well. Next, we'll go ahead and check the popliteal. So I'm going to have you bend your knee up for me. A little easier to feel this way. Going behind the knee here. Check sides here. Go ahead and relax your leg for me. Good. And the right popliteal is a 2+. Go ahead and check the left. Relax there. Good. And that's a 2+ as well. All right, let me have you put this gown back on there. I'm going to have you sit up for me, bring your legs over. Good. All right, next section we're going to go over is neurological. I've done most all of the cranial nerves throughout the test. So the only ones I haven't done were the cranial nerves 1 and 2, which is the olfactory and optic. I won't be doing those for these tests, but if I were to check this, the olfactory, I would use something. It would be some sort of smell for the nose. So we usually use like lemon, chocolate, or coffee, something that's recognizable to most people, and have them see if they can smell the proper ones. And then for the optic nerve, we'd use a Snellen chart, which I don't have, but that's a way to check the optic nerve as well. Next, we'll go ahead and check your sensation for sharp and dull. So I've got a paper clip here. This is going to be the dull. This is going to be the sharp, okay? Mm-hmm. So what I'm going to have you do is just close your eyes. Let me know which one you feel, okay? Sharp. Dull. Dull. Sharp. Sharp. Dull. Good. And patient was able to answer all the sharp and dull correctly, if you didn't hear him. Next, we're going to go ahead and check some reflexes here. So first, we'll start off with the brachial on your arms. Go ahead and rest your arm on my hand here. Good. And brachial is normal on the right. Go ahead and check left here. Good. And normal brachial on the left. We'll go ahead and check the knee. Go relax your leg there. Good. Normal reflex of the knee. We'll go ahead and examine the Achilles here. Good. Normal Achilles on the right. Normal Achilles on the left. And let's go ahead and check some muscle strength here. So go ahead and press down on my hands. Good. Press up. Good. And out. And in. And up. Bring these up against me. There you go. This one.
It's good. It's a little awkward to do both.
Yeah. And outside. And inside. Good. And we've already checked the arms, but we can go ahead and do that again as well. Go ahead and bring your leg, arms up. Don't let me press them down. Good. Bring them down for me. Don't let me press down. Up. Good. Bring your wrists up. And down. Good. And my hand. Good. And that's all normal there. Patient has normal muscle strength. We've already checked the cervical spine as well, but I can go ahead and do that. Bring your head all the way forward. Good. No signs of scoliosis in the neck. Bring your head all the way up, side to side. Turn, turn. Good. And I'm going to have you go ahead and stand up for me. And all right. Go ahead and lean all the way forward. Touch your toes. Any pain with that?
Nope.
Good. And while the patient bends down, I'm looking at any signs of scoliosis, which I don't see. Go ahead and come up. Extend back for me. Good. Turn side to side.
While extending back here.
Yeah. Good. And right, come down. The other way. Good. And patient, you can have a seat again. Patient has normal full range of motion of the cervical, lumbar, and even the thoracic. And that go ahead and concludes our exam today. Thanks a lot, Nick.
Mm-hmm.
And thanks for watching.